Hi, my name is Rina Vertes. I have been working in healthcare for over 3 decades and have focused a good portion of that time on what drives healthcare costs and what the financial results could be if changes were implemented. As a patient and consumer of healthcare services, a taxpayer, or a purchaser of health insurance on behalf of your family or your company, you should be concerned about the cost of healthcare. Can you or your company afford to continue to pay the premiums? Can you afford the increasing out-of-pocket expenses? Can we as a society afford it? There are several reasons why the content of this course is relevant and why you should care and want to learn more. Healthcare in the United States costs too much and does not provide sufficient value to consumers and patients. Additionally, healthcare is complex, and better understanding the many factors that influence cost and annual increases is critical to thinking through how we can fix it. Many thought that the Affordable Care Act, or the ACA, would fix all of the health system woes, but in reality, it did not. It is a good example of legislation intended to fix certain aspects of healthcare, specifically access, but does not go far enough to address healthcare cost issues. The ACA is predominantly focused on insurance reforms to improve access to health insurance and healthcare, and less focused on the cost of healthcare. There are indeed provisions in the ACA intended to address cost. However, in my opinion, many of the cost-focused provisions of the ACA have a long runway for implementation and a lag in terms of when we will see results. There is an urgency to address these issues now. We will review the drivers of healthcare cost and solutions that have been proposed to address cost, quality, and the value of healthcare. Many put blame for the high healthcare costs on payment models that pay healthcare providers for every service they provide to patients, essentially paying more for volume and service intensity. This is called a fee-for-service, or FFS, payment model. Some solutions, arguably the more sustainable solutions, combine strategies including new payment models, care management, insurance plan design, consumer engagement tools, and technology. Using that information, we will explore the various situations, showcasing coordinated care and payment strategies that can be implemented to improve patient health and the cost of delivering healthcare services. I think about this all the time, and I am excited for you all to join me and many others in trying to solve the concerns around healthcare in the United States.